Nearly 1 million people in the U.S. are living with Parkinson's disease. According to the Parkinson's Foundation, that number is expected to rise to 1.2 million in 5 years. So joining me now is Dr. Mian, the Director of Functional Neurosurgery at Swedish Medical Center. And first of all, tell us what the first thing is you need to know if you're diagnosed with Parkinson's disease.
I think what I'd like patients to understand is that Parkinson's disease is a progressive disease and it does affect lots of different aspects of your life, but it is very treatable. And I think diagnosis often leads to disappointment, depression, but patients should know that there are resources out there for them and there are many ways to help ameliorate the symptoms.
Absolutely. And as a doctor that works with movement disorders, how do you decide what treatment a patient needs? Is it medication or surgery right away? How does that work?
So in all cases for patients with Parkinson's disease, the first step is the diagnosis, and then most patients will be candidates for trials of different medications. Parkinson's disease, we think, relates to a loss of cells in the brain that make a chemical called dopamine. And so many of the therapies that we start with initially are intended simply to replace that dopamine with medications. And patients who start those medications can often see many of their early symptoms disappear or get much better for years sometimes.
Wonderful. And if a patient can do surgery, what can they expect before and after?
Yeah. So surgery is something we consider for patients with Parkinson's disease after they've had the disease for a few years and have started to develop problems with the medications. Surgery nowadays is something called deep brain stimulation, or DBS, and it consists of putting a tiny wire in the brain that's about 1 millimeter wide and connecting it to a little pacemaker that we put in the chest. And patients often see dramatic improvements in their movement symptoms after this kind of surgery that persists for years and years. And what I typically tell patients who are having this surgery is they can expect their Parkinson's symptoms to be set back by about 5 years.
Wow, okay. And we know, unfortunately, there's no cure right now for Parkinson's, but are we getting any closer to one?
There are a lot of studies ongoing, and so I'm very hopeful for the future. I think because this disease relates to a loss of dopamine in the brain, there's hope that by introducing therapies like gene therapy, we may be able to teach the brain to make that dopamine again, but nothing like that is on the immediate horizon.
All right. Well, thank you so much, Doctor, for all the information. We really appreciate it.